to you? Can you hear me clearly?
Yeah, I can hear you clearly.
Okay, perfect. What's your name?
Arunima.
Aru, sorry, Arun?
Arunima. Arunima.
Arunima. Okay, perfect.
We'll be starting soon now.
Okay.
Om Amriteshwarya Namaha. Humble pranams at the lotus feet of our beloved Amma. It is my great pleasure to warmly invite you to the 4th Annual National Undergraduate Medical Summit, SPUST 2021. As undergraduate students, we all have a lot of doubts about our future. Like, should we do a PG next, or are there any other options? But today, thankfully, we have eminent and experienced panelists from all over the world, and they will help us. Now, it is my great pleasure to introduce the moderator for today's session, Dr. Colonel Vishal Marwaha. He is a veteran of Indian Army for 28 years. He completed MBBS and MD from the prestigious Armed Forces Medical College, Pune, DNB in Internal Medicine, 2 years fellowship in rheumatology from AIIMS, Delhi, and short-term training at Nottingham, UK. He was awarded Chief of Army Staff Commandant in 2012 and Army Commander Commendation twice in 2008 and 2010, and currently our beloved principal at Amrita Institute of Medical Sciences, Kochi for the past 5 years. I welcome you, sir.
Good morning, everyone. Om Amriteshwaraya Namaha. Humble pranams at the lotus feet of our beloved Amma. Dear all, it is indeed a pleasure for me to welcome all the speakers and delegates to the panel discussion on career counseling options after MBBS. As a principal, I am asked many questions by my students whether I should do a clinical or a non-clinical subject in post-graduation. Can I do MHA or MBA? Can I do aviation medicine? How do I join the armed forces or central CAPF, that is CRPF, Border Security Force? What are the avenues as a medical officer? How do I get to US, UK, Australia, New Zealand? There is a plethora of questions. Today we have with us Dr. Keshav Swarnkar from UK, Dr. James Kingsland from UK, Dr. Sonia Singh from USA, who has studied in UK and Australia too, Dr. Balaji Singh from Chennai, Brigadier Ajay Menon from AIIMS Kochi, and Dr. Dilip Kamath from AIIMS Kochi. We have faculty from different countries, different subjects, administrators who will share their experience with you today. I will introduce each speaker as they at their respective when they come in, and they will be speaking for 12 minutes, after which questions from students will be put up to them. If questions come in later also, we will put them up subsequently. However, if time constraints are there, we will send the questions by mail, and it will be our endeavor that take the answers from the speakers and send it to the students in case time constraints are there. I sincerely believe that this session will prove to be very useful for all the delegates. I pray to Amma for her infinite grace upon each one of us. We pray and hope that the inputs we receive will prove to be very useful for our students in planning their career. The order of speakers will be Dr. Keshav Swarnkar, Dr. James Kingsland, Dr. Sonia Singh, Dr. Balaji Singh, Brigadier Ajay Menon, and Dr. Dilip Kamath. We start with Dr. Keshav Swarnkar. Dr. Keshav Swarnkar did his MBBS from AFMC Pune, 1986 batch, and was one of the most outstanding students. I knew him from college days. He completed his FRCS from Edinburgh and Glasgow He is a consultant surgeon with special interest in laparoscopic and colorectal surgery. He is working in Anurin Bivan University Health Board and Newport, UK. He is a recognized undergraduate and postgraduate teacher. I welcome Dr. Kesha Swankar, and he is, I think it must be about little over 3:30 in the morning. So I wish him a very good morning and ask him to begin his deliberations.
Thank you very much, Colonel Mavaha, for your very gracious invitation to speak to the medical graduates on this occasion. I would also like to extend my thanks to my batchmate, Brigadier Ajoy Menon, who has also kindly introduced me to your institution. And it speaks highly of your institution, considering that he is an eminent colleague of mine, very intelligent. And I think that you have got a great asset in your team there. Having said that, my remit of the talk today was very clear as to give a career guidance or counseling to the MBBS graduates. And I've kind of delved into this under two very clear headings, speaking to Colonel Marvaha, as well as the student who was linking with me yesterday on Zoom. What is it they would like of me that will be of relevance to them? So it appears that first thing is they wanted to know my journey of post MBBS and then coming to UK and to be where I am today. And the second part of it is how does the UK fit into their sort of career plans, and what do they have to do to be able to come here successfully if they wanted to pursue their further education? So without much ado, just to give you a brief highlight, as Colonel Marva has already pointed out, I graduated from Armed Forces Medical College in Pune. I was from the Y batch, 1986, and completed my graduation in 1991. That is, completed my internship. I chose not to stay in the army for my personal reasons, because I wanted to pursue fellowship of the Royal College of Surgeons. I had my mentor, my uncle, who was a fellow of the colleges, and I always looked up to him. So that's a good way to go. If you have somebody as a mentor earlier on in life, it helps you to shape your thinking. And you kind of shape your life along how they perform in their real life. That's what I was watching from the sidelines, even as I was growing up. And that's a very important pointer when it comes to training in our profession. See the people who you can emulate in life and who are doing well in life. What is it that they bring with them? And there are certain technical knowledge-based qualities, and there are certain skills which they have. Try and emulate them. That's a very good guide. So I ended up coming to UK. And of course, this is 1990s we are talking about. This is pre-information technology era. Everything was by ground mail, snail mail. And I came through the route of PLAB, that is Professional Linguistic Assessment Board. And obviously, after I did my PLAB exam, I was allowed to register provisionally with the General Medical Council. I was very clear at that time that I wanted to be a surgeon. So it wasn't a question of trying to pursue anything different. And I apologize if I'm not sort of giving you much information around medical career paths, but they're almost identical. But the hint of my talk is mainly surgical based, that if you want to come here as a surgeon, there are various entry points. And once I switch over to my formal presentation, I'll clarify all of that. So I came here in 92 rather, and then started my training of 3-year period, going through different specialties of 6 months each to complete the requirement of my Part 1 FRCS, that was the old type FRCS. And then ultimately in 1996, completed my Part 2 of FRCS from the Royal College of Surgeons of Edinburgh and Glasgow. Right, so there we are, 3 years gone in UK, doing my time, doing my work. getting my vocational qualification as well as surgical qualifications. And then I was lucky, and I have to say that because 1995-96, Calvinization occurred in UK, and the training, the postgraduate training, became much more structured. It became time-bound, and then that allowed the people who had done their FRCS or MRCP to have a structured pathway for further training so that they could become independent medical practitioners. That is, if you are in the secondary care, you become a consultant. And if you go the primary care route, you become a general practitioner. And then, of course, I had 7 years of hard training. When I say hard, it was different specialties rotating, going from upper GI to breast, to endocrine, to vascular. And then finally, the last 4 years were dedicated to doing colorectal surgery. At the end of this 7 years of my training, plus the 3 years when I came to UK, that is 10 in all, I was then, I got my exit exam, that is now called as a part 3 exam or exit exam. And it is then that I was recognized on the specialist register of UK. And then I became the independent practitioner as a consultant, and the rest is history. I got appointed as a consultant colorectal general surgeon with a specialist interest in colorectal and then laparoscopic surgery back in 2003. So I'm almost 18 years into a solo practice, and here I am. So that completes the first part of my introduction as to how I have reached where I have reached. Now I'm just going to share with you my screen just to take you through that. Am I visible at all there? I just wanted to know, I'm going to share the screen now.
Yes, sir.
And
You are visible, Keshav.
And what about the screen?
Yes, sir. The screen is visible.
Okay. Let me put this right at the very beginning. And here we are. So basically, that was the remit of the talk. So if you are planning to come to UK as a medical graduate, what are the steps that you need to fulfill so that you can successfully incorporate yourself into UK system, whatever may be your aim? You might be wanting to come here for a brief period to gain some experience of UK health system. You may want to come for a stint of specialized work, or you may, like me, come very early in life and perhaps got incorporated into the national health system of UK. Two basic requirements: you need a visa and you need a General Medical Council registration. The first part is certainly beyond my remit. It is with the Home Office, but the General Medical Council registration is the mandatory part for you to be able to work in UK as a doctor. So what are the routes to getting a GMC registration? You can come the standard PLAB route, that is Professional Linguistic Ability Board. This is a 2-part exam, and you can register with the General Medical Council in UK, and you can have very detailed guidance on the PLAB exam as to what the contents are, where you can take it from. And once you've done that, you are registered with the General Medical Council. I mentioned 2 other routes that may not be so well known, but it is something that surgeons might be interested to know, is that the sponsored routes coming as an international medical graduates. I'm a fellow of the Royal College of Surgeons of Edinburgh, and they have a very clear program where you can apply for the international medical graduate program. They will, of course, after due diligence, select candidates, and they will then allow you to, or rather organize for you to come to UK. They will organize your registration with the GMC, And they will also organize for you to have a job with one of the hospitals for the 2-year period. Now, by the look of it, it's a very structured pathway for people wanting to get a specialized experience in UK, and then of course, wanting to go back. There is no restriction on what they may do in the 2 years. If you wanted to convert into a different type of training program, you may be able to apply, but the whole purpose of this international medical graduate pathway or the scheme is for facilitating students from abroad or graduates from abroad to be able to come here for a certain specific period of time and take advantage of the UK training system. There is this third new pathway that is perhaps not so well known. It's called as a BAPIO Training Academy. The BAPIO is actually British Association of Persons of Indian Origin. This is a new body and has an increasing sort of medical political role, particularly for Indian doctors. And what they have recognized is that a lot of international medical graduates coming from India have certain difficulties in obtaining registration and subsequent jobs. So they will facilitate that part of it. And they are almost like an international medical graduates program. They have recognized certain hospitals in India where they have given a curriculum which you have to follow. And once you have followed that curriculum and fulfilled the requirements, they will come and select you. And then you will be placed in various hospitals in UK for a specified period of time so that you can get further enhanced training. So once you have the full GMC registration, you're considered at par with a graduate medical doctor in UK at F2 level. So bear with me, this slide is very important. This is the medical school bit, 4 to 6 years. Then you come into what we call as a foundation program, year 1, then a foundation program, year 2. They are both of a year each. Now, as you can see, correspondingly, here you have a GM provisional registration. It's when you complete this period, you get your full GMC registration. So if you come from India after doing your internship equivalent, you're joining at this level. And that is foundation year 2. Beyond this, if you want to go into secondary care, as we call it, that is hospital-based practice, you've got 5 to 8 years of different specialties that you want to pursue. So you have to competitively enter into this, be selected, and then complete this period of training to get your completion certificate of training. And this is the sort of the golden ticket, as it were, which allows you to practice independently as a consultant. That's the route I went through, albeit by default, because this was not the case when I had arrived in the country. The other route, which my colleague will be talking after me, is perhaps related to primary care. That is the general practitioner vocational training program. A lot of the doctors may not want to be in the hospital practice. They perhaps enjoy working in the community with the people, and they want to develop their skills in that direction. That's perfectly reasonable. And they, of course, finish 3 years training. Then they also have an exit exam, and they go on to become general practitioners. And I would like to add that general practitioners and consultants have a fairly mutually respectable roles in the society. So we do honor each other's opinions. There are other routes. I don't want to go into greater detail, but as I said on a previous slide, this particular section, there are lots of ways of entering here. There is something called as uncoupled postgraduate training. This is called as core and higher specialty training program. So in between your F2 and your specialty training, you can have 2 or 3 years, depending upon your desire or your ability. You may spend time in various specialties before you say, this is the specialty I want to go for. So there is a place for such jobs. There is another new development. Now some people just want to do emergency medicine. So there is a 3-year training program that normally follows F2. And it is the only core training program where trainees want to go into emergency medicine, they can go into. So lots of flexibility built into your postgraduate training in UK. This is for the completion's sake, but there are lots of alternative routes which UK uses to facilitate training, so that trainees of different backgrounds, like, you may have, don't want to sound sexist, but there are maybe ladies who have family and they have got significant commitments, and they still want to train in various specialties which may be clinically very demanding in secondary care. So they have an option of less than full-time training, and they can do 2 days or 3 days of work in a hospital, and the remaining 3 days they don't. But of course, that means they have a longer period of training, but they can still complete their CCT that way. There are certain training posts called as a fixed term specialty training. There may be some candidates who need an extra training or to complete their requirements, so they would go into these jobs. And then there are locum appointment trainings where the trainee is absent for a very long time for a variety of reasons, may have taken a sabbatical to go to a different country. So they'll be filled in by, these posts will be filled in by surgeons through this route. So you got your golden ticket. You're now on a specialist register with GMC. Now you can work as an independent medical practitioner, consultant, or GMC. There is, very quickly, just tell you alternative career paths. Lots of overseas graduates may not want to work as an independent medical practitioner for a variety of reasons, or they could not qualify through the competitive route, but still want the experience and may even want to go back to their home country after they have gained adequate experience in UK. So they can go down the route of clinical fellow, staff grades. These are sort of the designations, but these are non-training posts. Non-training route, you can gain considerable experience at registrar level, and that's quite a responsible post. And they can independently manage the patients for service commitments. So they've got a slightly different designation, but increasingly we are coming to a point in UK where they will be managing a lot of services independently outside of consultant supervision. So just so that you know. You can still become a consultant or get your CCT by a special route called as Article 14, but this is perhaps a bit too much at your level to sort of go into. There is this other route, those with a clinical sort of academic bent of mind. You want to be an academic, you like research, teaching, both, but more towards that sort of thing rather than clinical. You can go down this route. I need not emphasize that these colleagues are highly regarded because they work for both NHS and the university. They carry out lots of research. They produce evidence base for the treatment, and of course, improves the quality of healthcare overall. Again, this is something you can get from website as well, but you can see that there is an independent pathway which runs alongside the clinical pathway which I chose to go by. Whereas you can go academically this route. If you can come as a BSc, then do your part 1, part 2, but this is a part of the medical school requirement. You can crisscross, but you have to do your MBBS alongside and keep going this way till you get your CCT and ultimately get incorporated into university and NHS practice here. So lots of options. One of the students who I linked up yesterday was very, very helpful in that. I said, what do you want to know from me? Considering that you want to come to UK. And she said, I'd like to know what it makes, what do I need to do for being a successful applicant? And I could think of these 3 things. Number 1, if you are coming at, say, you've completed your post-graduation or basic post-graduation or basic MBBS, you have to fulfill the mandatory criteria, the essential criteria of the application, that you have completed these requirements. But more importantly, which I think I wish I knew when I came to this country, you should have certain more things which we call as a desirable criteria in UK. What else do you bring alongside your basic medical education? So that is generally your prowess for research audits and that kind of thing. So evidence of medical audits, it's highly regarded in UK that you have engaged with the clinical services, you're looking to the improvements, and you have that kind of thinking mind. Certainly, surrogate markers of your academic prowess is presentations to local meetings, national meetings, and international meetings. It's not uncommon for medical graduates in UK to have done the work even as they are graduating, and to have taken their presentations to various meetings. So that is something I would encourage Colonel Marbaha for students to think about carefully and be on a lookout for. QIP, that is Quality Improvement Project. This is the new term which has got more aligned to the management, but it is basically anything you can do to improve the patient care within the system that you work in. So you keep looking at different angles, how the patient-centered care can be improved, and then do the study, as we call it, then assess the shortcomings, suggest the improvements, and bring about those changes. So that's again considered as a very sort of powerful way of expressing yourself on the CV. And of course, those candidates who go on to become or be selected for the postgraduate training pathway, and I'm talking about surgery in particular, one of the statistical factors was they should have had at least one first author publication in a peer-reviewed journal, in a good peer-reviewed journal. And that's very important because again, it is about your academic prowess, it's how you apply yourself, and do you take the tasks to completion. Are there anything else that is important for the students? You can look at other extracurricular activities demonstrating leadership. Now, this is increasingly important because doctors are not just medical people, they are human beings who have got high capability of performing in various domains. And one of the things that constantly comes about in our conversation is clinical leadership. It's about being able to run the show, take the show forward. And I don't think there's any dearth of it in young graduates in your institutions, because this whole conference being organized by the students is itself demonstrating to me that. Finally, just a few points that I'd like to share with students. You are coming to work in NHS. These are the nuances. It's a publicly funded service, free at the point of delivery. So here the patients have a high level of what we call as an autonomy. Confidentiality is very important, and the consent from the patient is above all the most important thing before you intervene. Secondly, working in teams. This is increasingly realized that we are working in systems. We are aiming to provide high quality, assured, safe care. And that's the word, safe care. High quality, competence-based training. So whatever you learn, you are competent at it in being able to deliver safely in a continuous learning environment. So you will always be finding that you're moving on. There's information coming in from different angles, and you have to engage with it and bring about that to the patient's best interest. And I would like to say within reason, considering we have compared our health system to others, there's a good work-life balance. So there's something to be positive about. Finally, what do you aim to deliver if you come to National Health Service in UK is it's a quality assured safe care. We always aim for that. It has to be underpinned by good clinical leadership. Do everything within your power to develop this skill in a value-based healthcare environment. Now, this is the big thing now. We got to be very prudent with what we spend on the patients and how much, and does it really bring benefit to the patient? So I couldn't summarize it better. Quality assured safe care, good clinical leadership, and value-based healthcare. Thank you.
Thanks, Keshav. It was a very wonderful talk, and you covered a lot of things very well. And I think these were the things we were looking at actually. And lot of clarity has emerged, especially what you said about mentorship. Even this BAPIO training academy is very something I was not aware of. So it's very good to, a lot of things have emerged which will be very useful for our students. So I thank you for your talk. I'm sure the questions will be coming, so we will probably move in as the questions come. You got some? Some questions have come, Keshav.
Yeah.
What do you think has changed over the years in UK healthcare for international medical graduates applying to UK?
Right. The things that have changed is that, and I could say that I'm a kind of a living example from being an unstructured postgraduate training pathway to a very structured pathway. So what that has given is given you something to aim for. You know the entry point, you know what you should have already done or what you need. Whereas, so that's one thing. The other thing is, I would say that, there's a lot of information about do the overseas graduates suffer because they are not locally qualified? I suppose you could look at it in a variety of ways, but the equality diversity issue is now a big issue. I'd like to encourage that you should apply nonetheless. And if you are a competent graduate, then you will have a fair crack at interview and other things. I suppose the visa restrictions that used to be placed on the international medical graduates before, we used to come on a 4-year permit-free training. So that not necessarily squeezed your ability to try different things. You had to be very clear, this is what I want. That has changed. And finally, it's become much more flexible now. There are lots of entry points at different levels, and you could even convert from a service kind of training, which was not a training post, into a training post halfway through, or apply for being an independent medical practitioner through Article 14, as I have alluded to in my talk. So these are the changes that have occurred.
One more question, Keshav, is that the medical system in UK and India are so different. How can an Indian medical graduate fit in or adjust to the system?
Right. I think that's a very interesting point. I think I do a lot of reverse thinking. I say, what if I have to go back? How will I fit in India? And I think one thing I would say is that because of various reasons, particularly our colonial links, our education system are very identical. And particularly the MBBS part of it is also very similar in terms of what we link, what we study, and how we come into the knowledge base that we have. But I would say the nuances I'd referred to you in my talk, that NHS is a publicly funded system, so free at the point of delivery. So there's no discrimination at that level. It doesn't depend upon the ability to pay. Secondly, as I said, the UK culture says that patient confidentiality and consent is foremost. So that's the autonomy of the patient. So you got to do everything for the patient, irrespective of what the organization's saying. You got to make the patient safe. You got to give him the quality assured care. And thirdly, I would say that at a personal level, what will help is developing not only the knowledge base, but open yourself to learning a little bit about other people's ways of life. And that is something that is not to be frowned upon. You're not losing your culture by adopting new methods from other countries. They may be soft skills, but one thing that underpins easy incorporation into UK is having a good, effective communication skill. Practice that, do that. Say what you mean what you say. And the other thing is there is a bit of a sort of understanding in UK. If you don't maintain eye contact with the patient or with me, then it is considered as you may not be completely honest. So try and do that.
Thank you, Keshav. It was a wonderful talk, and we are very grateful to you for sparing your time, especially very early in the morning.
Thank
So
you,
now,
Secretary.
yeah, and we move on, and the next speaker for the day is Dr. James Kingsland. He is an OBE, Office of the Order of British Empire. He is a primary care physician and formerly the senior partner in a nationally renowned award-winning general practice in the northwest of England. He holds an honorary position as clinical professor in the School of Medicine, University of Central Lancashire. He devotes his professional time between teaching, clinical practice, national advisory roles, and for company boards. He has a wealth of experience in general practice, medical education, and he is the co-creator of the new care model, the primary care home, the principles of which have been utilized by NHS England. Currently, he is president of National Association of Primary Care Physicians, School of Medicine, University of Central Lancashire, England, UK. Over to Dr. James Kingsland.
Hello, my name is Professor James Kingsland, and my greetings from West Kirby, which is situated on the Wirral in England. It's across the Mersey estuary, so our nearest town is Liverpool. I'm a primary care physician and a clinical professor in the School of Medicine at the University of Central Lancashire. I've worked in all sectors of the National Health Service for over 30 years, but 31 of those has been as a general practitioner. But I'm also delighted that I am the primary care lead for something we developed called the Faculty of Disaster Medicine across India and Nepal. I won't have time to discuss this because I appreciate this is a presentation focused for career counselling as part of your undergraduate course. I was delighted to actually be in the Amrita Institute of Medical Sciences and Research in March 2019, and I do hope that I can return one day. In the short time that I have, my friend Dr. Vishal, who had invited me to give this presentation, just a short presentation, was to focus on some of the opportunities specifically related to the National Health Service in the UK after you've graduated. Working in the UK can be an appealing career option and is so for many Indian doctors, just as Indian doctors are an attractive recruitment proposition for British hospitals and general practice at this moment. The reasons cover cultural, historical, and very practical reasons, because most Indian medical schools use similar textbooks and curricula to the UK, which means knowledge and skills are largely transferable. There's currently thought to be around 20,000 doctors from India already in practice in the NHS, providing a useful support network for new arrivals. So there's a well-trodden path across from India to the UK. And that the cross-cultural awareness is particularly valued by those NHS organisations serving large multicultural populations, a very diverse population that now lives in the UK. The NHS, of course, is considered one of the top healthcare systems in the world, and there is high international demand for the knowledge and skills acquired by those working in it. So if this is not something that may be attractive for the long term or for a career, it may be very attractive to use some of the facilities for the early education and training and the development of your skills, which may be then transferred internationally. So the UK has always been a popular destination for Indian doctors, and at the moment, your skills are in high demand. If considering making that move, Indian doctors can be confident that there are many other ways of making the same journey, and numerous doctors and organisations are happy to help with some of the cultural differences and challenges that working in a new country throws up. There are a strong association called the British Association of Physicians of Indian Origin, BAPIO. There's lots of support through the British Medical Association and Royal Colleges linked to particular specialties. And for mine, it's the Royal College of General Practitioners. And they're available to help doctors and often have dedicated sections on their websites. So always worth looking at the websites to get more information about doctors who are thinking about working internationally. Also, the General Medical Council gives information about the requirements for transfer, as does a site called NHS Employers. But working in one of what is considered the world's best healthcare systems not only provides invaluable experience, skills and knowledge, but boosts career prospects anywhere in the world. I think I'll just talk now a little bit more detail about the route into the NHS and linked to general practice. There's probably never been a better time to consider working in the UK. We are talking about a significant shortage of doctors. The NHS currently thinks it's got nearly 10,000 vacant posts, and we've been talking for a number of years in the reforms of primary care, and particularly general practice, where we may need up to 5,000 new general practitioners in the immediate future. The government has admitted its reliance on recruiting overseas doctors, and that reliance is going to go right through to the next 2 or 3 years as we're looking to fill some of these vacant posts and replace those posts that are coming through retirement. The government has removed its tier 2 visa cap for doctors and nurses wishing to work in the UK. And there is pressure from employers to make the registration and language testing process simpler and smoother for overseas doctors. But at the moment, there are requirements, and one of them, which is the common requirement, is something called the Professional and Linguistic Assessment Board test, or better known as the PLAB test. This helps to make sure that doctors who have qualified abroad have the right knowledge and skills to practice medicine in the UK. The question about whether you need to take the PLAB test will depend on where you're at in your career, but after qualification, the PLAB test does check to know that a doctor can do the same as starting in the second year of a foundation programme training in the UK. After you've qualified in the UK, there's 2 years called the foundation programme, and before full registration, these are internships, but they also cover work within general practice, and the PLAB test qualifies that you are equivalent to the second year of this foundation programme. The test is in 2 parts. Part 1 is a written multiple choice examination. There's 180 questions. You can find this online. Part 2 is a practical OSCE, an objective structured clinical exam, and you'll need to pass both parts before you can apply for registration with a license to practice medicine in the UK. You'll need to set up a General Medical Council online account before you can take the PLAB test. And the good news is the PLAB test can be taken in India. So there's a number of centres, but the GMC will need to know that your medical qualification and a knowledge that your English is acceptable, and there are language tests as well that need to be carried out just to qualify that that gives the completeness of qualifications, registration, the linguistic assessment boards test, and the language test. I say it's in part 1 and 2, and once you've passed both parts, you can then apply for registration with a license to practice. Important to know, though, that your application must be approved within 2 years of passing the part 2 of the test. And once the application is approved, you can gain registration and work as a doctor in the UK. Finally, just a bit of practical advice for what I think is huge opportunities for doctors from India to work in the National Health Service anywhere in the UK. Of course, the National Health Service now is more or less devolved into 4 parts across the 4 countries. So the governance of the NHS is different in Scotland, Wales and Northern Ireland to England, but we still recognise it as one service, but opportunities in all 4 countries. The average doctor in India, as I understand, earns between 12 and 20 lakh rupees, as equating to about 13.5 to 22,500 pounds. In comparison, trainees in the UK earn between 27 and 31,000 pounds per annum for around a 40-hour week. So there are financial benefits as well, but of course that has to be balanced around the increased cost of living. But as you go into specialism, that earning can go between 39 and 73,000 pounds. Salaried GPs, once you're fully qualified, can earn between 60 and 90,000 pounds, although there's no upper limit dependent on the nature of the work. And consultants start on around 78 to 80,000 pounds, to give you some sort of idea of the earning potential, but balanced against, of course, the cost of living. Some colleagues have given me some information about things they wish they'd known, and 2 pieces of advice that I've seen is that the way you practice with patients in the UK is similar to India. The main difference that Indian doctors notice is that patients just can't make an appointment with a specialist doctor. They must be referred by their general practitioner. So the process is people across the UK register with a general practitioner. That is their first contact, their first port of call. And if somebody needs to see a specialist, it's via referral from their general practitioner. And many Indian doctors say that they think that's a better system, and it's certainly a system that allows the NHS to be free at the point of need, not based on anybody's ability to pay. And another colleague saying the main advice I would give Indian doctors considering the move is to keep a very open mind and not listen to some of the rumours. There's a lots of rumours, I understand, in India about working in the UK, and this colleague said, I would say only about 10% of them are correct. So always look for accurate information. You'll need information if you're thinking of applying around immigration and visa processes, about the detail of GMC registration, which I've given an overview for, but from provisional registration, getting your courses finished, the PLAB, etc., to full registration. But whilst it sounds fairly daunting, a well-trodden path, a well-structured process, and certainly welcoming arms from the UK and the NHS for our colleagues from India. I do hope this has been some benefit. I am hoping to get over to Kochi in the future, not least to be doing some more of the primary care advice on disaster medicine, and I very much look forward to visiting your lovely part of the country. I do hope you've had a good conference. My best wishes to you all. And should you wish more advice or a follow-up, please do it through the conference organisers. They can contact me directly. And even as you're still in an undergraduate world, then opportunities to come over to the UK to experience some undergraduate exchange program, to look at doing some advisory work or having a look at some ways of getting some experience as an undergraduate, we can always make those arrangements. I hope that's been of some help. It's goodbye from me.
Thank you, sir. It was a very good coverage of a very important topic. And, after Dr. Keshav, him speaking and highlighting about the general practitioners, actually, that is a very one thing you will find, like when I was training in rheumatology in UK, I found that, they have to come through the GP and referral may not be immediate. Whereas here you find people can directly enter. So there are some differences, but they have a system in place and it covers the whole country. So, that makes it.
Vishal, you are muted.
Sorry. Can you hear me now?
Yes.
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 Thank you. So we thank Dr. Professor James Kingsland for his deliberations, and there was a lot of clarity in what he spoke, and we highlighted the general practitioner system and that modality also. That is also one of the ways, because everybody may not want to go into specialization. So options available are more. He highlighted the various things. I think after Dr. Keshav and him having spoken, there is a lot of the understanding improves. Now, I will request Dr. Sonia Singh to speak. She is a graduate from the Armed Forces Medical College. In fact, we are from the same batch, 84 batch of AFMC. And also we were from Bangalore, because we both are Punjabis, but my father and her father both were in the DRDO. So they were actually very good friends too. And they were stationed in Bangalore. So we used to go from Bangalore to Pune in the train, and so we had some wonderful time. Then those days, Bangalore, unlike now, was a very beautiful place. Today it's hugely constructed and all that. Presently, Dr. Sonia Singh is basically, she's a pediatric emergency medicine physician at Sacramento, USA. She completed her internship from General Medicine Nationwide Children's Hospital, Columbus, Ohio, and residency from Children's Hospital of Pittsburgh. She has done her MPH, Master of Public Health, from the University of Pittsburgh Graduate School of Public Health, USA. MBA from the University of Pittsburgh Katz Graduate School of Business. MSc in Health Economics from University of York, UK. And PhD from the University of Melbourne, Australia. She is also a part of Healthcare India, American Red Cross, and Healthcare Solutions. So it's indeed a privilege to welcome her. I tried to get her last year, but somehow she could not come. Even this year, she had some challenges, but I'm very grateful to her for making it. We now look forward to her talk. Thank you.
Thank you. Pranam. Thank you, Colonel Marwa, for this invitation. So I wanted to start by sharing. I'm not sure if they're sharing my slides, so I can share mine. That way I know what everybody's seeing. And so let me just start with that. Okay, sorry. So can you see my slides?
Yes, ma'am.
Yes.
Okay, perfect. Thank you. So, I wanted to just sort of highlight, so in your undergraduate career, you see people like me who have so many alphabets after my name, and I just wanted to sort of bring it back to reality and just question what's in a name. Life, when you've had 30 years on this planet, sort of following a journey that you couldn't see 30 years ago. I put myself in your shoes and just wanted to share not only my experience, but also with that advice to help you along the way. And before I start, I just want to, acknowledge the people whose shoulders I stand on, my parents, my late father, who just passed away a month ago. The PhD that I'm doing is for him. I have not completed that yet. I'm 6 months away from completing my PhD. So, it truly is, we are who we are because of the people who support us along the way. And a lot of my success comes from finding the right mentors who've helped me. So let's, with that, move to the next slide, which really sort of, as Colonel Marwah said, I was lucky to have graduated from AFMC, although at that time, I don't think I had appreciated as much till later on in life when I look back and realized how much I had learned. When you start medicine at 18 with no one else in your family who's done it, often it takes a bit of time before you find your roots and find out how to learn and play the game, so to speak. And so, I've been learning, and that's who I am, a student still trying to, get the hang of things. And that's what my journey is about. And so I didn't serve in the Army. I was very clear that I didn't quite follow instructions well, and so I wouldn't have survived. And so my parents were, wise enough to pay me out. So I did my internship at St. John's Hospital in Bangalore. And while I was doing my internship, I took the GRE and advanced GRE exams for America so that I could apply for graduate school. And I actually came here in 1990 to start a PhD in molecular biology. And my dream was to do pediatric immunology. And I did two semesters at Rutgers University in the PhD program. And then I moved to Pittsburgh for personal reasons. I got married and, my husband was in Pittsburgh. So I had to find a way, you come with a full scholarship and then you have to transfer it. And I was lucky to be able to transfer into the Masters of Public Health program by working in a lab that paid for the education. And so while, I was doing that, I took the exams. So in those days, it was the ECFMG and the FLEX exams. And then you apply for residency. And so I sort of straddled, I was finishing up the MPH and then started my internship in pediatrics at a small community hospital. And what you see is, normally a pediatrics training is 3 years. It took me 5 years because I was stubborn and I started at a small community program and I did a year and I felt that I wanted to be at an academic center and I wasn't getting enough exposure. And so I quit and I did a year of research at the Children's Hospital of Pittsburgh and I reapplied and I started again. So I did really 3 internships, 1 in India and then 2 in the US. And I started again at 95. And I finished at my hospital in Children's of Pittsburgh, and they had 1 position for the Pediatric Emergency Medicine Fellowship. And, it's all about working hard and proving yourself, because in those days, international medical graduates weren't really given much opportunity. And you had to be better than them to really get ahead. And so I did that and then, was there for 10 years, got as an assistant professor of pediatrics, being a clinician educator, so very much in academics, still, wanting to do research, wanting to complete that PhD that I had started but not finished. And so, I didn't quite know. All I knew is that I wanted to have a backup plan in case I got tired of medicine. And so the MBA was, again, the University of Pittsburgh supported it, paid for most of it. And so, why not, right? If you can get free education, you do it. And so that's what I did. I really didn't know what I wanted to do with it, but I still just did it. And I got promoted to associate professor in 2012. And as life would have it, I met an Australian in New Delhi when I came to give a talk at NAPEM, which is the National Pediatric Emergency Medicine Conference. It was the first one. And he invited me to Australia. And so I started doing that process. And it took me about from 2010 to 2012. So 2 years of application to the Australian Medical Council. But I was lucky enough that they gave me, I got a full-time consultant job for 4 years. And they allowed me to work with what they say, observe, or, they observed me for 18 months to make sure I didn't do anything wrong. And then, I worked as a consultant for 6 years. And during that time, again, it was this, let's do this PhD. And Australia is great in that postgraduate education is free if you're a permanent resident, which I had become. And so I applied for this PhD program, and I was looking for ways of how do I add value. And health economics obviously is a great tool in the UK used by the NHS, but it was beginning to sort of take ground in Australia. And so I said, why not? I'll learn. And so I applied for scholarships and a Fulbright. I didn't get the Fulbright, and so I decided I would pay for it by myself. And so I went to the UK for a year. And there are two really good programs for health economics. One is the London School of Economics, which is really good for health policy. And then the University of York, which is really good for what we call econometrics, so really math heavy. And I wanted to stretch my brain a bit and learn a bit more math. And so that's what I did. And then I went back to Australia, applied for the PhD, and then felt that I needed to have the right mentors. And so I approached the head of the emergency department here at University of California at Davis in Sacramento, Nate Cooperman, who is the world leader in pediatric emergency medicine in head injury in kids, and convinced them that they should take me as a research fellow, which is basically going back to training, right? So you can imagine most research fellows do that after their residency. So I took a pay cut, came back to be a fellow, just so that I could get protected time to do research and get mentored by him here. And then my PhD supervisor in Australia is the equivalent of him there. So really getting the best of the world to train me on how to do research. And so the last 3 years have been doing that, spending time in Australia and time here, to be able to focus on research and less clinical time. And the interesting thing is, so as I finished my PhD, and my research fellowship, I was lucky to get a job here. There were 2 positions that they were hiring for, and there were 50 applications in the emergency department. And I was lucky to get one of them that I will start in January. But the interesting thing is I start as an assistant professor. So it really is going back, so it's going from assistant professor to assistant professor in 20 years. And so I say, what is it in a name? And if it's your ego and what you care about is that, then it would be looking at and saying, I'm going backwards. But when you're looking at it from freedom of expression and following your passion, it truly is opportunity, an opportunity to grow, an opportunity to learn, and really at the end of the day, an opportunity to excel. And so I have learned over 30 years that we achieve things by having a team and a team of people who support you, who teach you, who encourage you, not only mentor you, but sponsor you. And, you know, I was an average student at AFMC and just continued to just persevere and not give up. And that's where I am today. So I wanted to just share with you my two prides of joy, my daughter Amrita, who's now 25 and applying for medicine, and Milo Singh, my little puppy, who's now a year old. And this was when he was 7 months old. He's a little rescue dog that I got. And they really teach me, you know, everything I have done is only as valuable as having raised them. So thank you. And I just wanted to stop sharing and then talk to you a little bit about my experience of having worked in two continents. I think that America, you know, is a great country for people who want to dream and work, and the sky is the limit. As long as you work hard, you can find the opportunity to excel. There are ways. Now, obviously, when it's been a while since I took the ECFMG and USM and the FLEX exams, well, we have enough network of people who have done, who have come from India. Even in the recent, I have one of my batchmates' daughters who did her medical school in New Delhi, was able to come and is doing a radiology residency. Actually, she's finishing it this year and is a chief resident. And, you know, so we have enough people within our network who can help you navigate that. And then I was surprised when I worked in Australia to understand that they actually value Indian doctors more than American doctors. In fact, they think that Indian doctors are better trained, work harder, and are better skilled than American doctors, which my ego took a little bit of a, you know, and so I started saying I was from India more than I said I was from the US, because I just got a little bit more respect. But they really, you know, I think I was lucky that I didn't have to take the Australian Medical Council exam, but there again, we have enough, so many physicians, AFMCites in Australia, even recently, who have gone there and who are doing so well. It is an incredible country. It gives you so much opportunity and pays you really well. And I think a lot of the UK doctors are going to Australia because not only do they get the 40-hour work week, but they get much more pay and a better work-life balance. So, you know, they're really, the world is your oyster. You just have to follow your dreams. And, you know, we, Gunnar, we are all here to sort of help you. And if I don't know the answer, I know people who can. So I appreciate this opportunity. And humbly, I thank you for this.
Thank you, Dr. Sonia Singh. It was such a nice, it was very beautifully the way you expressed. And, you know, I just want to share with you the motto of our university, Amrita Vishwa Vidyapeetham, that is Shraddhavan Labte Jnanam. So when we see your trajectory, it sees how much you have, you know, strived to improve your, you know, your quest for knowledge has been phenomenal. It is something, you know, I don't think that associate prof, assistant prof, all these things really matter, because the way you have, you know, in fact, I shared the same thing 2 days back at the inaugural when our Dr. R. Krishna Kumar spoke. He did his MBBS from Maulana Azad, then MD from AIMS, then DM from AIMS in adult cardiology, went to Boston, did pediatric cardiology. From 98, he has been working here. So it was so beautiful, and I was so impressed that the effort you have taken to study health economics. In fact, my daughter is also doing PhD in health economics. So I, in fact, told her to speak to you. I said, Dr. Sonia Singh is doing, and she had a long conversation with you. So I'm sure there will be a lot of people here, because sometimes, like you have done MBA. One day I was asking some students, about 14, 15 students. I just asked a question, I think 17 batch in my room. I asked them, who doesn't want to pursue medicine? So one chap immediately raised his hand. And he says, sir, I want to do MBA. So, okay, then I connected him to one of my friend, Dr. Samson Jesudas, who came last year on this conference, him. And he told him, after, I think, his communication, as if, what did he say? He said, do post-graduation, then do PhD. So he says, sir, either way I have to do PhD. So it was very nice. And your point about the Australians liking the Indian, that was something which I was not aware also. So I think we should all be, our students should be, aware of all these things. And I think, as you said, one has to pursue the passion. So, and that also, at ab initio, what do you know? When you start your journey only, as you move ahead, you will know what is your strength, what is your weakness. One doesn't know. So one may have to do mid-course correction. I think sometimes, it happens that you are in a clinical, then you realize, no, you need to probably go into that. Any questions right now? Okay. So I'm sure questions will come mostly by end of the, so another half an hour, 45 minutes, there will be many questions coming in. Anything else you would like to say, Dr. Sonia Singh?
No, thank you. Really, I really wish the students the best, and we are here to support them. So if anyone has any questions, I'm always available.
Thank you very much. Now, Dr. Brigadier Ajay Menon, he will be speaking. Again, he's from AFMC. He did his MBBS and MS from the Armed Forces Medical College. MCH in Cardiothoracic Vascular Surgery from Sri Chitra Institute, Trivandrum. Underwent training in minimal invasive cardiac surgery at Stuttgart, Germany, and has performed and assisted more than 1800 CTVS cases till date. He was the pivotal member of the heart transplant unit at Army Hospital R&R Delhi Cant, and he helped set up the Department of Cardiothoracic Surgery at the Naval Hospital, INHS Aswini in Mumbai. He was the commandant and CEO of a military hospital in Bhopal, so zonal hospital, and has an extensive knowledge of medical procurement. He has a flair for writing, is a keen quizzer, and is also a paratrooper. Currently, he is the senior medical administrator at Amrita Hospitals, Kochi, a very able administrator, teacher, and cardiac surgeon. Over to Brigadier Ajay Menon.
Thank you, sir. Am I audible?
Yes.
I must at the outset thank Colonel Marwa. I'm from ex-batch FMC, Dr. Sonia, same batch. Keshav, my batchmate. It looks like a college reunion. I think this is just an excuse to my mind. And frankly, I think I'll start with a small story because I look at a different angle of the issue here at hand. The very fact that there is a felt need for a discussion on careers after MBBS gives credibility to the growing perception that just an MBBS in India no longer has any armor protection. So let me begin with a small story. A certain Miss India was asked why she sacrificed a career in medicine to take part in a beauty pageant. And she replied, if I continue with medicine, I'll sacrifice 10 to 12 years of my life in a village of my prime youth, unlike engineers and bureaucrats and lawyers, and then get physically abused in a hospital in India if the patient deteriorates for no reason of mine, no fault of mine. But if I win Miss World, my superstar status will give me movies, advertisements, maybe a Padma Shri, and nobody will question me if I charge crores for a movie or if it flops. And then she lived happily ever after. This story is, of course, apocryphal. But it is true that there is a need for students to understand that with MBBS degree, things are not over. Your life has just begun and you want to start thinking right away. Because tragically, in India, the allopathic medical profession has often become subsumed in a morass of legal and ethical landmines. And not the least because the explosion of information technology has resulted not only in better career prospects, but equally in mushrooming Google doctors who have ample time to critically review every decision that you make. But I digress here because here we are, all of you doctors in the making. And the moot point of the discussion is, what will I do after MBBS? Perhaps the correct question that we should be asking yourself is, who am I? And though this sounds rather existential and confusion, it is relevant at a point of introspection because there is nothing more tragic than doing what you're not meant to. The first dictum is to do what you like and what you have an aptitude for. And for this, you have to keep asking yourself. It is not the ability to look cool or to pursue something that seems to be glamorous, but what you are instinctively built for. Now here, this presupposes a very important point of judgment, and that is over the last 5.5 years of your baby steps into a medical world, you should have made up your mind as to what you are instinctively good at. Now, normally this would have been an easy choice in, say, law, management, or the fine arts and humanities in general. But in medicine, there is no shortcut to decision making, and the steep curve of your learning is a journey that is without end. Now, but as I've been chosen on this panel with my background, I must restrict this conversation, like my predecessors, illustrious predecessors have, to what my personal journey has taught me and how it can help you in making a considered decision in this choice. Like my predecessors, I joined FMC. I left JIPMER and I had left St. John's Medical College and I joined FMC in '86. And if my experiences are a little biased because of my alma mater being the best medical college, the second best medical college in India in the last half a century. So it is based on the irrefutable fact that nowhere in India are doctors more insulated and free from the corruption of the world than in the armed forces here. For it is in the armed forces alone that there are no commercial dealings with the patients, and doctors are not lured by offers, and if called upon to do so, will often put their lives at risk, whether in the battlefield or elsewhere, which is a far cry from many healthcare systems in India. Even at the outset of my conversation, let me make it clear, but after 30 years, having got out of my own volition with what is known as a VRS or a premature resignation, I still consider the armed forces as a very good option. The past 35 years, I did my internship in a hospital in Punjab and then was in Kashmir during the counterinsurgency problems, working with very good civilian and military co-workers. And I was at the highest battlefield of Siachen in 6 months. It's a Guinness record. And I traveled to all states in this country. And I've been abroad to the United Nations. I learned Portuguese to do better. And I've interacted with female and male soldiers and paramedics and doctors of all nations, including Pakistan. And as a bachelor's, then this is something which I tell all my medical students, that my colleagues helped me drive a tank, fly a fighter aircraft, helicopters. I learned how to sit and operate a submarine. And officially, I've served in a warship at sea. I returned hardened by field service to do my MS in general surgery, which I was a gold medalist in the University of Pune, and then teach and then become faculty in FMC, after which the Army gave me opportunities to do a whole range of surgeries in various hospitals and even funded my MCH in cardiac surgery in a civil institute at Sri Chitra. Now, I was able to learn because I was given an opportunity to do so. And I think it has a lot to do with the fact that the opportunities came at the right time. So, over a period of time, I was able to understand that what is required is to identify yourself, what you are good at, and what you have a propensity to do. I was able to learn the very basics of surgery in an environment which was kind of conducive for it. The point I'm trying to make is there's no dearth of opportunity if you choose your career yourself. As far as the armed forces is concerned, I want to make some ground rules very clear because a lot of people come and ask me, how do you join? Your decision has to be made well before you turn 30. You have to have your permanent registration in the Medical Council in India. And you have to have a working knowledge of Hindi. And I know this because a lot of my batchmates and my colleagues were South Indians who did not know Hindi. And believe me, it's not very easy. The other thing is that your parents or spouses, if any, are able to live with you without seeing you for the first at least 5 to 7 years of your life, because that's the time when you are in field service. barring the 2 months of annual leave and casual leave and whatever. And in case you're a teetotaler, you're willing to adjust to people who drink, and you must be willing to understand the ethos of working with soldiers. And lastly, you must accept what is a transferable job, because you have to move every 2 to 3 years, no matter what excuses you have. And so the armed forces does throw open doors which are not available to many, but it's only a fraction at present who get a permanent commission. That limits the number of people who can be guaranteed a lifetime of service, especially since the criteria for short service candidates to get permanent commission is very stringent. And but the big advantage of joining as a short service candidate is that you get some extra consideration for seats in your post-graduation in India in the NEET PG. So if you are an ex-serviceman quota, you get some automatic consideration. But bear in mind that after these 5 years, you're over age as compared to colleagues. It didn't matter to me, but it does matter to some people. But it's not the armed forces alone. I've seen doctors in the BSF, the CRPF, the National Disaster Management Force is a good place to go. And so is the CISF. And if you are, let's say, a person who does not want to get a transferable job, I've seen a lot of ladies who have joined the Airports Authority of India, a very good place to begin. The ONGC, and I've been to SAIL, SAIL, the Steel Authority, where doctors do very well. And of course, there's countless PSUs, but then it's debatable. Of late, there's been a huge surge of interest in oceanography and aviation medicine, marine medicine in civilian life, which was exclusively the privilege of the armed forces earlier. But bear in mind that it's the armed forces who trains Olympians. I've seen people take up sports medicine, and they train our Olympians of today, the national hockey and football team. It's a very important job. And now cosmonauts, because it's the armed forces in India who trains cosmonauts. So that's a separate branch of space medicine which is coming up. And it's not surprising, therefore, that these branches are coming up outside the armed forces, especially in Bangalore as well. So let me talk now less about the armed forces and quickly get back to the next agenda, that is the changing trends in so-called happening specialties. I will not take much of your time. Being a surgeon, I have sadly seen general surgery being engulfed by super specialties in India. The general surgeon is left with little more than hernias and hydrocele, the usual rectal pathologies and bumps and lumps, unless he or she picks up a skill set that brings him or her at par about a far more sophisticated ambience of a super specialty. This is not to say that a person with a DM or an MCH can offer better care than an MD or an MS. Far from it. There are extremely competent general surgeons as there are incompetent super specialists. And thirdly, not all super specialties are equal. I have seen the rise personally. I have seen the rise and fall of cardiothoracic surgery as a specialty. And today it's at the bottom of the pile for people who opt for MCH and DNB. In the last 3 years, there have hardly been any takers for cardiothoracic surgery in India. 79 seats fell vacant last year. 84 have fell vacant this year because of hard working hours. The steep learning curve. It takes decades to master cardiac surgery. Massive infrastructural costs. Thin profit margins, aggressive commercial growth of cardiology, on which CTS is paradoxically dependent, and a general lack of understanding amongst both doctors and the lay people in India of the value of surgical bypass grafting over multivessel stenting. But that's a separate debate. Therefore, a choice of a career after MBBS often gets skewed by market trends. And there are perceptual differences and peer pressure combined with attitude towards a particular work ethic. Surgical specialties need a peculiar proclivity or an inclination towards a very visceral experience by opening up tissue and a different kind of courage. But the big charm of spending all your days and nights in the operating theater and the ICUs, including Sundays, should be balanced, say in neurosurgery or in CTS, should be balanced by your ability to balance your family life and your commitments. I say this because a lot of people take up a specialty which probably they are not tuned into. And this has a bearing in their future. So before I kind of conclude my talk, I would like to just allow this to sink in because it's relevant to what you do in your lifetime. Choose a career which you like to do. Do not do it merely because others are saying that you should do it. So before I end, I'd like to share screen. Can you see the screen? Is it visible? This is just to kind of show you the life that a person leads in the army. You can drive a tank, you can go up the highest mountain on earth, you can learn how to fly a helicopter, you can even choose to go up expeditions in Kanchenjunga or Everest or wherever. So, and you can go on UN missions. You meet all kinds of people. And when you meet people from other armies and other navies and air force and other establishments, you realize that you really broaden your mind, and it kind of it broadens your perspective. And it also gives you an ample opportunity to learn little things: how to drive a train, how do I drive a truck, things like this, which medicine doesn't teach you. How to I was told to negotiate with the guerrillas before a war broke out. And because I knew Portuguese, I learned the local language. And this is the last slide, which is for all of you. It's in a lighter vein. Someone says, I don't know what medical specialty to choose. So what's the problem? Oh, I like nothing. How I have grades? My class hates me. Do you like to cut? Yes or no? If the answer is no, are you socially awkward? No. Okay, so what can you fake an interest in? Is it for the eyes, or is it dermatology? Is it rashes, or is it just the screen? Or if you like to cut, what do you enjoy doing in your free time? So based on your proclivities and inclinations, you can choose a super specialty you want. And if you like people, are you willing to touch them? Then you take physical medicine rehab. If you don't, you take psychiatry. If you like people, you can even take, if you don't like people, you can take pathology. If you're a nerd, you take paths. If you're just average, what do you think of kids, so on and so forth. So this kind of flowchart is obviously not scientific, but what I'm saying is it probably will help you make your decisions. So on that note, I think I'll conclude here. I must thank all of you for giving your valuable time to listen to me, and I hope I've been of some use in this panel. Thank you so much.
Thank you, Brigadier Ajay Menon. It was such a wonderful, insightful. And I was reminded when you were mentioning that you can drive a tank. I was RMO of an armored regiment. So we went for, we saw 3 field fires, and one was with the main battle tank Arjun. So I still remember that, I got the opportunity to fire, that fire and drive a tank and including an ambulance APC. So that time I used to play hockey, and we used to play fullback. There was one Risaldar who retired as Risaldar Major, Jagrup Singh Brar. He was that time, so he was the person who, taught me how to fire, how to load a high explosive squash head. And, so it's such a great opportunity which you get in the armed forces. I was with 6 Rajput, in anti-terrorist operations. And I remember once, once I got an opportunity to be part of a combing operation. So, the JCO taught me, So you learn a lot from your environment. What Brigadier Menon was saying, he has been to Angola and he was telling me about all the challenges there which he faced. And also he visited Afghanistan also, I think, for a short while, I think. Am I right, Ajay? Yeah. So, it's a very good thing, and I think what he said, you have to basically know what do you like, you do what you like. That is very important. If you feel you are cut out for management, even while MBBS, you can go for MBA. There are so many options. Dr. Sonia Singh was telling, she liked health economics, but why not? You can. What is there is, where is the age? Where it is set. See, even somebody I was reading at 81 has cleared the, 81 or 85 years cleared some exam, 10th standard exam. So I think it's all about what you like, you pursue. Like I personally also, I'll tell you, when I was I was in Bhutan, actually. I was posted in Indian military training team for 2 years plus. And I remember that is the time when I was choosing. We had 3 rheumatologists. What actually was told by our Dr. Keshav also and Dr. Sonia about mentors. We had 3 excellent rheumatologists when we were doing our MD. Actually, one of my batchmates, Shankar Subramanian, myself, and HS Chaudhary, one batch senior. 3 people took rheumatology because we had very good mentors. So I chose the subject which I wanted to do. I did not go by what the, so you do what you like. I think that is very important. Somebody wants, has liking for something. If you like physiology, you do physiology. I can tell you will do very well in physiology. Lot of our students I am finding now, they're wasting 4 years. Now, this is where the country has to think. When I was, going through some, literature, say if there are X number of MBBS students, the PG seats are half of X. Obviously, it shows that many people will not get, but everybody thinks he will get post-graduation. So what is going to happen? People are going to waste 4 years, 5 years, get into depression and get frustrated. Many of them don't, even take up any job. I think that is not a very great thing actually. We look at this, they must increase the DNB. Either you give post-graduation to everybody, why not? People should do something. But the fact remains that, there are like, in army, armed forces, basically, Army, Navy, Air Force, you have to work as a medical officer for 4 to 5 years, 3 years, 5 years. Then you become a specialist. Then you work as a specialist for 4 or 5 years. So you don't become a rheumatologist or a cardiologist. I think I finished maybe 37 and Ajay also finished his cardiac surgery around, I think 38, 39. So, you will not be able to finish it like, and if you really look at it, that people who are going for one degree after the other, they haven't really, sometimes, how much have they actually practiced general, as a medical officer and as a general surgeon, then got into a super specialty. There are a lot of questions, which remain unanswered. So it's anyway, the government is allowing something. So, but you see the employer is not allowing. At a particular age, say you are in army, and you are a neurologist. One of my student, he told me now he's going as CEO of a field hospital. He's a neurologist. So it's okay. You have to develop your administrative acumen also. After all, that is also important. So I think I will stop at that. And any comments I will ask from Dr. Keshav, Dr. Sonia, and Dr. Ajay before we take on the next speaker.
The one thing I just wanted to add is that, like you said, often it's always good to recalibrate. So we have dreams and we think we want to try something. For instance, I wanted to do pediatric immunology. And when I worked in an immunology lab, I found that I hated it, right? So it's all about trial and error, trying things, following your dreams, and then willing to step back and take things in and then grow in a different way. And, life is all about that. So it really is about listening within and being true to that voice rather than following what somebody else is doing.
Yeah, thank you, Dr. Sonia.
If I may, I don't wish to be preaching to medical students, but having spent a lot of time in this part of the world, I would, if in any way, try and influence the medical institutions and the curriculum in a way that you have a whole systems thinking way. What is happening is that in India, particularly from where we all came, we had a very sort of a tunnel view of medicine. This is what we do. This is our place in the society. And we tend to sort of box ourselves in it. Whereas coming to UK, one thing I notice is that they're very connected to the society. The whole health service is very responsive to the needs of the society. That's the difference in National Health Service. That's why they made this free at the point of delivery, that access is universal. We won't see what you can pay. You can get a quality health service wherever you go. And I think, there's a very deep philosophy behind it. Now, I don't know whether it's in the hands of politicians, but I still feel that it's up to the medical fraternity in India to be sort of influencing that, whether at policy levels, whether at economic level, whether at executing the medical service. But it's up to the doctors to influence that. And how we do it in UK, or rather how they do it in UK, is that the Academy of Medical Royal Colleges provide the scientific side of it. The British Medical Association provides the sort of the trade union aspect of the doctors. You can't be misused. You are, after all, a very valuable and highly trained, skilled workforce. And at the same time, the government is constantly talking to these organizations to tell them what is it that we need to be doing so that it is in the public's best interest. So I kind of think about it a lot of the times, and I ask myself a question: can we do this in India? Should we be doing this in India? And I think we should. We should. And you have got lots of talent. You got lots of very highly skilled people there who are intelligent. And it's about applying those things in a coordinated and integrated fashion. So, the emphasis being integrated healthcare. So, that from the time you enter the health service, there is a connecting link till you get sorted out. Aim for that. And if you can achieve it, there's no reason why Indian healthcare can't be the best in the world. You have got the best doctors anyway. Thank you.
Thank you, Keshav. There's a question for Dr. Ajoy Menon. Sir, you have trained in Germany. How was your experience there? And why Germany at that point?
All right. I took leave. I took leave to train myself there because the growth of cardiac surgery is different in different continents. The Australians have done a wonderful work with the off-pump surgery and with pediatric cardiac surgery. The Europeans have done a beautiful job with minimally invasive surgery, where the Germans are the best. Their instrumentation and their techniques are far ahead. The Americans have done a wonderful job with dissections, aortic dissections, operations on the tricuspid valve, and so on and so forth. So we in India are learning from everybody. Now, one thing I'll share with you is what a German surgeon once told me. He said, "You people have such tiny hands, but you're so nimble." And I found it true, because when I went to Europe, I found that let's say if the left internal mammary artery was very large, the structures were large. So one didn't have to use very fine sutures. So for an Indian, we work on much smaller vessels, because our Indian population, like the Chinese, we are generally smaller people. Our vessels are small, but our work is very fine. But the reason why I went to Europe is the cradle for instrumentation and new technology. So this is the other thing. You got to choose the place where you go based on what you want to learn. If you want to learn transplant surgery, the place to go for it is the UK. So that decision comes much later. So, but of course, it's also got to do a lot with your planning. You've got to plan everything at each phase in your life. I hope that answers it.
Yeah, very good. Thank you. Thank you, Dr. Ajoy. There's a question for Dr. Sonia Singh. Having studied and worked in so many countries, which do you think was the best work-life atmosphere?
So thank you for that question. It really depends on where you train. So because I trained in the US and I went to Australia quite late, I found it difficult to practice in Australia. And so when I came back here, it felt like coming back home. Having said that, the work-life balance in Australia is much better than the US. You just have to choose where you live. There's a bit more racism in Australia. It's changing, but it's there. A comedian here said that Australians are comfortably racist. And so I saw that more. I felt it more there. They tend to prefer their own when they hire. But if you have trained there, they consider you their own. So, I think that one has to choose these things wisely. Personally, for me, when I came here in 1990 to the US, I felt like I was coming home. It just fit my personality better. But if I were to do it again, if I was young, I think the opportunities in Australia are incredible, and you really get respect, and you get, the pay is really good. So you really get a great work-life balance. You just have to be aware of you go.
Another question for you, Dr. Sonia Singh, is how did you adapt to the various social and cultural difficulties?
Yes, another good question. I think a lot of it is being able to speak. We grew up in India speaking English, and like Dr. Menon said, you need to be able to speak Hindi in the army. In Australia and the US, you need to be able to speak English clearly and communicate. Communication is a big thing, and if you learn that, then you are able to deal with people who, not like India, not unlike India, are quite feel that they're entitled to healthcare, right? They want to get what they want. The US is very famous for that. You might not be able to pay for anything, but you want the best. And we need to be able to talk to them respectfully, but still, be able to provide reasonable care. And so a lot of it has taken skill I have learned over the years, where, you have to realize that you get frustrated or you get angry and find a way to just calm it and be able to communicate effectively with people. And I think that has sort of been my biggest sort of success. Learning from other people, learning from your colleagues. People have different skills. So if you know some person, the way they talk and the way they communicate with other consultants, you learn from them and you adapt as you go along. So I think it's about being humble, quite honestly. If you're humble and you come into some place willing to learn and work hard, you can do anything.
Thank you. Thank you. I think that was very well covered and very well answered, actually. So there is basically adaptability, is very important. Whenever you go to a new place, you have to adapt. Like I remember when I went to Bhutan, they're different, they'll sometimes a patient will come and put an egg on your table. That's his gift to you. So you have to accept it. So that is the way it is. So they may give you some, piece of cheese. You have to adapt to and I think all of us are, basically humans are adaptable by nature. So you have to adapt to the environment. Like I just share one sort of a, incident. Once I was, it was peak winter and in Rajasthan is very cold. There was one patient I went to see at night. I was deployed in one of the units, 17 Jat that time. So I, after seeing the patient, it was very dark. I lost my way, it was a New Year's Eve. So I moved in somewhere, and somewhere I saw some light, So when I walked there was this guards unit. Now they were celebrating New Year's Eve. It was, I think, 11:30 or something. So what Dr. Ajay Menon was saying, you got to adjust with the people, So they all, I told them I am RMO of, this unit and this is what has happened. So they said, first they made me sit down. They said, sir, you have to have a drink with us, So I had a drink with them. So, and snacks and all, 10 minutes. After that, they helped me out. So ethos is very important. You have to adjust with the, people there. They will, have their own. Each society is like that, So I don't think if you go with an open mind, then you can manage. I think anywhere. Like Dr. Sonia has worked in, UK, US, Australia. She is able to. Obviously, her inputs are very valuable for all of you and for us because you get an idea, the mindset, because even I found my 2 months I spent in UK, I had a good time actually. That is, I thought it was their approach is good. The system is very good, I thought. Their systematic approach, like, people crib here that, sir, you can't go to this. They take 3 months. I said, yeah, listen, they have a system in place. Don't forget that. And the GPs are very well trained. And to get a person, that to be certified GP also levels that they have GPSI, GPs with special interests. They are all very, and when you interact with them, you're right. They are well trained people. So it's not like their understanding of the subject is good. It's all right. And they also have system in place. Like they have early arthritis clinic. I can only comment about my subject. So a person with, say, early features of rheumatoid, he will definitely get a look in rapidly. So an emergency and all obviously is that. So one can criticize any system, but then every system will have its strengths and weaknesses. No system will be perfect, no, always. So we move on. Thanks to all of you for your excellent guidance for the students. Now we move on to Dr. Dilip Kamath. Dr. Dilip, he has completed his MBBS from Goa Medical College. Then he did his MHA from Manipal Academy of Higher Education. He was telling me that in third year only he decided that he would do hospital administration. Post MHA, he has worked in Bhavnagar, Gujarat, Kasturba Medical College, Manipal, Chennai, and now as a senior medical administrator in Amrita Hospitals, Kochi. He has also completed medical law, postgraduate diploma in medical systems from Symbiosis, Pune. I personally had a lot of interaction because of his, experience in Manipal. He is very, like in our inspections and all, I find that he has a very good understanding of the process because he has dealt with the same. These are very big challenges. In fact, we had a recent inspection where Dr. Ajay Menon and Dilip Kamath and all Babu Rao, all of the, were, our administrators, because we needed all full support because it's a major inspection of all the departments. So you realize that as a team, eventually when you, kick in together, you eventually do well. Over to Dr. Dilip Kamath.
Good morning. So firstly, I would like to thank the organizing committee of SPUSH 2021 and Marwa sir for giving me an opportunity to speak to you all on this Sunday morning. Marwa sir said that he completed his MBBS in the year 1984. Sorry, 1984. He started at 84. Yes. Yes. So sir, I was born in the year 1987. So I don't know why I'm here. I think I'm the youngest of the lot. Most of you have the total number of years of experience is equivalent to my age. One of the things that I did was I was the first member of my family who decided to pursue medicine. And when you take a decision of pursuing medicine at 18 years of age, you don't know what you're getting into. And by the time I was in my third year, I was not sure why I am in this field. At that point in time, I call myself the Orkut generation. I wouldn't even call myself the Facebook generation. And at that point in time, the amount of connect that you have with your alumni and your seniors is not that much. So I was able to speak to only one individual who decided to choose a field of hospital administration from my college, Goa Medical College. And this was a gentleman known as Dr. Vivek Talaulikar. He is presently the CEO of Global Hospital, Mumbai. And at that point in time, when I spoke to him, he was Chief Operating Officer of Sterling Hospitals, Ahmedabad. So you can understand that when I was about 21 years of age, I was talking to somebody who was about 10 years senior to me. And that was the only source of information that was available to me to take this change in career path. And based on the conversation that I had with him, I decided that hospital administration or healthcare administration is something that I'm going to choose. Over the years, since 2013 onwards, the 8 years that I have been in this domain, usually on a year-to-year basis, I would have about 5 to 6 people who would reach out to me from different parts of the country, mostly over Facebook and then subsequently over LinkedIn. But if you go to see over the past 2 or 3 years, the number of people who are reaching out to me to discuss this alternate career path, that is hospital administration, healthcare administration, is about 2 or 3 per month now. So there has been a sea change in a number of doctors who want to pursue administration field. And the most common question they have is, should I be doing a MD hospital administration? Should I be doing a master's in health hospital administration? Should I be doing a MBA? Or should I pursue a postgraduate program in management? So you have multiple options. So this is some clarity that I would want to give to the prospective individuals who want to pursue this field is MD Hospital Administration is a full-fledged 3-year program which is NMC recognized and run by most of the top medical colleges in the country. One of the things is every medical college hospital needs a medical superintendent, and that medical superintendent has to be MD degree qualified, MD or MS degree qualified, a postgraduate which is recognized by NMC. So if you want to work in a medical college and you want to rise in the path and over a period of time rise to the rank of medical superintendent or become a dean of a medical college, pursuing a MD degree makes sense. So for that, you need to answer a NEET, get into one of the MD programs which is run by the medical colleges, and then move along the path of senior resident, assistant professor, professor, head of department, and maybe subsequently rise to the rank of medical superintendent. So this would be one of the pathways that somebody who decides to pursue MD hospital administration can think of. It doesn't mean that you cannot go along the corporate ladder. There many MD hospital administration individuals also move to the corporate side also. Regarding MHA program, MHA is a 2-year program which is run by some of the deemed universities as well as some of already established institutions such as TIS Mumbai, IHMR Jaipur. Amrita has a good MHA program. Manipal has a good MHA program. Sri Ramchandra has a good MHA program. So these programs are basically 2-year programs, okay, which are open to non-MBBS candidates as well. So you have people from BDS background, BHMS background, BMS background, as well as even biomedical engineering backgrounds, nursing backgrounds who do these MHA programs. So here what happens is you are mixing with I consider MBBS to be slightly elitist. But when you mix up with all these kind of candidates, the kind of exposure that you get, the kind of interactions you have is slightly different from one which you would have in an MD program. So in an MD program, you will typically be having a batch of 2 or 3, but in an MHA program, you're going to end up in a batch of 15, 20 or 30. The third thing would be an MBA program, which many of the top B schools in the country offer, such as Symbiosis, XLRI, SP Jain, okay, some of the top B schools offer. So you have 2 types of MBAs over here. One is your general MBA, and the second option being your specific healthcare MBAs. So specific healthcare MBA, it restricts. You have subjects of general management, HR, OB, but the primary focus would be on different domains of healthcare system. That could be IT, insurance, normal hospitals, and the emerging industries. Okay, but general MBAs tend to be very open. That is, they focus on all the kinds of real world issues. Okay, that would not, you will not have a specific semester or a specific elective with regard to hospitals. So the only thing that you will be doing, you'll end up doing is maybe an internship in a hospital or maybe in a medical devices company or a pharmaceutical company. So but the advantage of doing a general MBA is, suppose somebody has decided that medical field is something I've already got tired of, and now I want to do something else. Maybe I want to move into consulting. I want to work maybe for FMCG. I want to work for oil and natural gas. I don't want to do anything. I don't want to do anything relating to MBBS. It really makes sense that do a general MBA, move along this path. And the fourth option is a postgraduate program, which the top IIMs of the country offer. You have IIM A, B, C who offer it. Then you have your Indian School of Business, which offers it. It's not an MBA, but it's a postgraduate program which is offered, which is usually a 12-month program. Okay, and these also have it is along the lines of a general MBA. Okay, but the requirements for doing the postgraduate program is usually you need 3 years of experience post your undergraduate degree. So it doesn't matter whether you've done your MBBS, BTech or whatever, but it requires 3 years of experience post your undergraduate degree, and then you can decide to pursue this postgraduate program. So once one decides that one has to change the path that you have taken, the most important question is, why do you want to change the path? right? So ma'am was telling about following passion. Sir was telling take the necessary course correction. So one of the first questions that I always get asked is, sir, how much will I earn after I finish my MBA, MHA, or uh, this postgraduate program? So the first thing that my mentor told me is there is a time for learning and then there is a time for earning. So you should never mix them. And the time for learning comes before your time for earning. So when you decide that you're going to change your field, when you move to this new field, the salaries that you're going to get is going to be on the lower side. Let me be honest, when I finished my MHA and I joined my first job in Gujarat, my salary was 50,000 rupees. Okay. And my classmate who decided to join the government service post his MBBS was drawing a salary of 75,000 rupees. So he's only an MBBS doctor and he was getting a salary of 75,000 rupees. And I had finished my MHA and I was getting a salary of 50,000 rupees. So should it disappoint me that I'm getting a lower salary in spite of having a postgraduate degree? I don't think the answer is yes for this. At least personally, I don't feel that is the correct answer, because it is a new domain which I had chosen to join, and it was a field in which I did not have any experience. So I was being paid for what I have, what value I was supposed to bring to the organization in the future. So deciding a career based on what is the amount of money you're going to make and what is the salary you're going to draw, I don't think is the correct step. Decide for yourself whether it is something you want to do 15 years down the line, whether you want to do this 20 years down the line. And if the answer to that question is yes, then definitely choose this field. Personally speaking, I've been in this domain for 8 years and I think I found it very fulfilling. Uh, why there were some of the qualities which I always see, and I usually talk one-on-one with people who connect with me on LinkedIn on why you should take this field and why you should not. And usually what happens is I end up convincing 25% of the people who talk to me in taking up a clinical field, because I feel that they might at 5 years down the line they might feel that they are in the wrong domain again, which I think is not a good thing to be in. So if you are a people person, you're good at planning, you are an out of box thinker, you have ability to handle pressure, you are a rational thinker. These are some of the qualities that you definitely need to be in a field of hospital administration. You need to understand that our healthcare system is undergoing a change over a period of time. When I was young, the point of contact for my healthcare needs was a GP. Then we moved into big structures called as nursing homes. Then we moved into huge structures called as hospitals in India, which were not then NABH accredited, JCI accredited. Okay, and the size of the infrastructure kept getting bigger. But if you go to see, if you want to deliver the healthcare needs of the community as well as the rural India, you don't need such big structures. Okay, you just need a small clinic and you need a doctor, a POC maybe, to meet most of the needs, okay, and have a good referral system. So the healthcare is going to move to the rural area, and more health technology is going to play a bigger role. So if you go to see, there are other domains other than hospitals which might be interesting choices for people who decide to choose MBA hospital administration or MBA healthcare administration. So you have the pharmaceutical industry, you have the insurance segment, health tech companies, home healthcare. I personally worked in a home healthcare company, and pre-COVID, we were managing about 100 patients. We had ICU at home kind of setups for about 100 patients in Chennai, Coimbatore, and Bangalore. We were managing 3 cities sitting in Chennai. We were managing 3 cities, patients in 3 cities, okay, with our nursing staff and equipment placed in patient homes. So the healthcare is gradually moving back to the community. Okay, and it is gradually moving to the tier 2 cities. It is gradually moving to tier 3 cities as well. So this is a very interesting field to be in. I think this is what I have I've written down. I think I'm open to answer some questions, and if post this conference also, if somebody connects with me on LinkedIn, I'm open to coaching them one-on-one. Thank you.
Thanks, Dr. Dilip. I think it was very good. What you spoke was very useful. There are a lot of students who are, I think looking at the doing hospital administration, business administration, and they keep asking us. I think this kind of your talk is actually very valuable because from that point of view, because that is sometimes you should know what you are cut out for. I think if you can do the correct career planning, you said very rightly that you felt that some people needed to go in clinical. I think those things are very important. And yeah, and actually you learn a lot from your peers. And you, as you very correctly said, if you are doing MHA in a place where there are only two people doing MD MHA, vis-a-vis you're doing MHA with 30 more people from background of dentistry, then nursing, and from maybe Ayurveda also. Yeah, and some would be from even science background. Yeah, so that's it's a all that also matters because that much more sort of you learn. So I think it's very good, very nicely brought out. So I think we are now coming towards the end of the our discussion, panel discussions. While before we close, I'll just ask all the speakers whatever they would like to furthermore add. We'll start with Dr. Keshav. Your audio.
Yeah. Thank you very much. What I'd like to say is that first thing is thank you all for giving me the opportunity to be here and having shared my thoughts. I'm sure you will find something that appeals to some or someone or all of you, but work on it. A lot of broad principles, as you know, go by your instincts. If you are good at something, follow your nose. Secondly, there's no shortcut to it. I'd actually share something that Sir Alex Ferguson, he was the manager of the Manchester United. Don't ask their scores now, but about 2 years ago, they were the top football club of this Premier League. But he said, what are the important qualities of being a good manager and a good skillful person? He said, first thing is availability. Make yourself available. Don't look for any shortcuts on that. You got to do it. You got to make yourself available. Then he said, be competent. So whatever knowledge you're acquiring, acquire it with a purpose. Don't try and sort of keep moving from here to there. Try and focus on what you're good at. Do that. So that's competence. And third is affability. Affability is very important in the real world. You are people's person. People like you for who you are. They will only buy from you if they like you. Remember that. And that's what he said. Now, using these things in clinical medicine is equally important. You're going to do something to an individual. They will only let you do things if they trust you. Build that trust. Work hard. Be good at what you are. And never, ever, ever doubt yourself. Thank you.
Thank you, Dr. Keshav. Now we'll request Dr. Sonia Singh to give her closing remarks.
Thank you. Thank you for this invitation. I just wanted to tell the students the world is your oyster. Yeah, as long as you work hard and you follow your inner voice, you can do anything. And sometimes failure is just another step, to recognize what you learn and then take that to that next step. And before you know it, you'll be 30 years down the line, sitting here with us and sharing your experience. Thank you.
Thank you, Dr. Sonia Singh. Very kind of you. I'll request Brigadier Ajoy Menon to give his closing remarks.
Thank you, sir. All I have to say is, please don't forget to live life yourself while you learn, because before you know it, you'll be in your late 50s, like all of us. And then look back and say, oh, why was I studying all the time and was not thinking? Please study by all means, but don't forget to live your life and live it every day. And the second issue, of course, is that do what you like to do. Do not let others choose what you like. That's all I have to say. Thank you so much.
Now, as far as thank you, Brigadier Menon. Now, I'll actually there are two questions for Dr. Kamath, so I'll request him to address them also and to give his closing remarks. One question is that at any moment in your life, have you ever thought of shifting from the management to clinical practice? And the second question is, can you suggest how to go about medical law?
So personally, no. Personally, I've never thought of going back to clinical medicine. I've not regretted the decision that I took aged 21, that this is not something which I'm cut out for and I don't want to do it for the rest of my life. So definitely no, I've never regretted that choice. I know a couple of my friends, industry colleagues, I would not call them friends, who were in MHA domain for about hospital administration domain for 5 years. And then they decided that one of them decided to pursue general surgery. And another gentleman decided that he wants to become a cardiothoracic surgeon, and he's a cardiothoracic surgeon. So he did his MD hospital administration. He was a deputy medical superintendent for 2 years. Then he decided that he wants to do cardiothoracic surgery, and today he's a cardiothoracic surgeon. So he did the course correction. It is a decision that one will take based on your liking, because you sometimes you come to it's administration is not very simple. You should be able to tackle a housekeeping staff to a neurosurgeon. You can imagine the intelligence level of each of this individual, the kind of background that this individual is going to come. And 50% of your time you're dealing with problems. You're dealing with problems from your clinicians, you're dealing with problems from your patients, you're dealing with problems from your vendors. You're just dealing with problems. And at certain point in time, you might just feel that why the hell I'm doing this. So the regulators also keep on making issues for you. The accrediting agencies keep on making problems for you. So you are typically dealing with problems for most of the time. So unless and until you have that level of patience as well as that level of thinking that somebody has to do this for the system to run, this might not be the correct field for you to be in. So choose the field for the right reasons, not for the money in it or not for the fame in it. So that is the most important call. So personally, I've never felt the desire to go back to clinical medicine. So second question was
medical law. How?
So
how can you suggest how to go about medical law?
Yes. So there is no full-fledged, I would say, a program for medical law in this country. That is a 3-year graduate program. Okay, so you have 1-year program which the National Law College Bangalore has, as well as a program which Symbiosis runs. So these are postgraduate diploma programs. So if you want to go into, you want to have a full-fledged career in medical law, what I would suggest is post your MBBS, do a full-fledged LLB program, and that will set you into this domain rather than just if you want to practice as a lawyer in the future. So you will need a LLB degree in case you want to practice as a lawyer in the future. So this is one of the most upcoming fields. And let me tell you, litigations in India, we don't see that many litigations, as many as errors that happen in India. But 10 years down the line, the number of medical litigations that will happen in India will be a substantial number. So if you go to compare what happens in US, UK, or vis-a-vis any of the modern countries or first world countries, the number of litigations is much less. But 10 years down the line, we are going to see substantial number of them. And medical law is going to be one of the fields 10 years down the line. So that's something which I would indicate. Yeah. And as far as my closing remarks are concerned, India spends less than about 1% of a GDP on our healthcare, which is a very low number. And this number is going to increase over a period of time. And AI, health technology is going to play a more important role in making this healthcare accessible to the rural areas. So being in the healthcare industry, okay, being doctors, being in this healthcare industry, you already have an edge versus rest of the world. You are in a field where there is not going to be any With COVID also, if you go to see, there's never going to be a depreciation with regard to this field. Okay, this field is going to increase 14 to 15% every year. So you are in the correct field, but take the correct choice, and that choice has to be based on your passion, not your earning potential or the fame that you're going to get in the field. Right? Thank you.
So before we close, actually, I thought the team here, the students who had organized this and the AV team are here, I thought it will be a good idea if you just have a, communication with them. Yeah, please come in. Yeah, come in. This side will be better, I think. Yeah, some can come this side. Come. Jaldi aajo, everybody. Come. So we have with us here Arunima Chellappan. She was the one. Can you raise your hand? She's the one who was the master of ceremony. She's been doing this for last 3 days. Amalendu, she is the organizing secretary. Then Samyukta, Steve, then Sritu, then Vishwas. Huh? Vishwas and Yatish Reddy, and actually one of our organizing secretary is a person who actually was set the ball rolling. He got COVID, so yeah, he is also here today. Nevin, are you there? Nevin, you'll have to switch on your audio. I think he's there. Contact.
Yeah, we can see him actually logged in on the panel.
Correct. He's logged in, so he couldn't make it. In fact, I think Monday he'll be joining in. So the conference today is the last day. So he did feel that, he missed out on this, but I think he'd done a lot of spade work, I think, and he kept working from his, workplace, home and hostel subsequently. So on behalf of all of us here, we thank all our panelists for joining us. In fact, Arati has also come. She is another co-organizing secretary. Come in fast. Yeah, Arati, again. They did a World Medical Association yesterday. I think she was the one who anchored it. So on behalf of all of us here, we thank all the panelists, and I'm sure that this session, I was told in the beginning, was around 900, and it's been generally around 700 plus audience. So 900 was the max. So it's a very good number, and I'm sure people all over the country, I think around 8 countries, you said, no? The people from 8 countries have joined actually. I think from many of our students in other countries have also joined in. So this inputs, I'm sure, will prove very useful for them. So on behalf of our medical director, Dr. Prem Nair, and the entire team of Amrita and Spash, we thank you all for joining us. Jai Hind.
Jai Hind.
Bye, Kesh.